title of my abstract is Pre-Hospital Ultrasound Quality Assurance. I want to give special thanks to Dr. Aideen Zanali, as well as Dr. Cameron Decker. Pre-hospital ultrasound is becoming increasingly more widespread across the country. According to ACEP's 2016 policy statement, challenges to the implementation of pre-hospital ultrasound include the need for careful physician oversight and quality assurance, and studies focusing on patient outcomes need to be conducted to further define the role of pre-hospital ultrasound. Currently, there is little literature discussing quality assurance for pre-hospital point-of-care ultrasound and its implications. The primary goal of this study was to determine whether the implementation of a pre-hospital POCUS QA system affect the quantity, quality, and the accuracy of scans performed. The secondary goals were to determine the most common exam performed, the most common indication for the use of POCUS, and if POCUS assisted in medical decision making. This was a retrospective review of POCUS exams and their QA reports submitted by 8 EMS field supervisors from May 2019 to March 2021. These providers are certified paramedics and field trainers at Harris County Emergency Center EMS System in Houston, Texas. They underwent a day of comprehensive POCUS training in May 2019 and were given additional educational material throughout the year. There were also 2 additional in-person scanning sessions for additional training. The QA of scans began in February 2020. The EMS providers used 1 of 2 Lumify probes for their scanning, and each submitted exam included the sonographer's name, basic patient demographics, exam type, indication, their interpretation, and whether or not their scan affected their decision making. Exam type includes cardiac, EFAST, lung, aorta, and other. All of the QA was led and reviewed by at least 1 EMS administrator and 1 ultrasound fellowship trained emergency physician. At least 10% of the scans were reviewed by the entire group for the purpose of interreliability. The reviewers commented on the quality of the exams using a scale similar to that of QPath of 1 to 5, with 5 being excellent. And they also provided technical and clinical feedback to the sonographers. The average number of scans increased from just under 3 a month to about 9 a month after the implementation of the QA system. The average quality of exams also improved from 2.19 out of 5 to 3.08. Both of these values were statistically significant. The accuracy of scans also seemed to improve over the study period from 35% to 44%. Because the QA system was not in place prior to March of 2020, we analyzed the data by looking at the first 6 months and the second 6 months post QA implementation. And the accuracy was defined as the true positives plus the true negatives over the total number of exams. The most common exam type was cardiac, followed by EFAST, and the most common indication for POCUS was cardiac arrest. EMS providers felt their ultrasound assisted in their decision making in about 24% of cases. However, in 10 cases, the question was left blank, and 9 of the questions were marked as maybe. In many of the cases where decision making was affected, the providers used ultrasound to confirm cardiac rhythm to assist in the determination of field termination versus continued resuscitation in patients with cardiac arrest. There are some limitations to our study, including the retrospective nature of the study. We had a relatively small sample size with about 117 scans submitted that were done over the year. The COVID pandemic also likely affected our results, as we saw a decrease in the number of scans submitted in the beginning of the pandemic. And there is potential for bias in asking the question if ultrasound affected decision making. In conclusion, our study shows improvement in the quantity, quality, and the accuracy of scans performed by EMS providers after the implementation of a pre-hospital QA system. Although these providers felt that POCUS affected care in only 24% of cases, it appeared to be most useful in cases of cardiac arrest, assisting in calling termination of efforts, or continuing resuscitation. Larger scale studies with continued focus on patient outcomes need to be conducted, especially in the setting of this study showing improvement in accuracy and quality of exams. Thank you for your time. Please feel free to reach out with any questions at my email here. Thank you.